This is Dr. Vickers with Texas Center for Oral Surgery and Dental Implants. I'd like to take a few minutes just to talk about what you can expect after dental implant surgery. The good news is that generally speaking, dental implant surgery comes with minimal postoperative discomfort. This can vary a little bit according to the complexity of your unique case. However, by and large, most patients tell me that they have just a little bit of pain, maybe they're a bit sore, but generally not severe pain. That being said, you may have been prescribed some medications to manage your discomfort after surgery. If you are prescribed some postoperative pain medications, just remember that it's best to get a little bit of food on your stomach prior to taking those medications. Also, you want to make sure that if you develop significant side effects from your medications, that you discontinue their use and check in with the office. Swelling is variable after dental implant surgery, but for the majority of straightforward implant cases, there will be minimal to no swelling. That being said, if you would like to use an ice pack to manage discomfort and potential swelling, feel free to do so. You can just alternate it on and off every 20 to 30 minutes for the first day or two. A small amount of bleeding is common after any oral surgical procedure, but generally a large amount of bleeding is not to be expected from dental implant surgery. That being said, if you feel like your oozing is persistent, you want to make sure to place some gauze directly over the implant site and squeeze your jaws together to place pressure on the surgical site. Pressure is the key to stopping bleeding. It is likely that you'll be prescribed a prescription mouth rinse after your surgery. If so, we want you to use that 2 to 3 times a day in order to keep the implant site clean. Also, beginning the day after surgery, you can gently brush the teeth as well as the dental implant site. Many of our patients will have a small metal post called a healing abutment that sticks up just above the gum level after a dental implant surgery. It's important to keep that clean. However, we don't want to cause it to come loose. So what we would like for you to do is use a soft bristled manual toothbrush to gently brush that healing abutment. As with any oral surgical procedure, it's best to start with soft foods and advance your diet to more normal consistency according to how you feel. When you feel good, you can eat whatever you'd like. The caveat here, however, is that we would like for you to chew away from the implant surgical site. If possible, and your implant is on one side, focus your chewing on the other side. I always tell my patients, I don't want you to drive yourself crazy worrying about this, but I want you to chew away from the implant whenever you can. For the first couple of days after implant surgery, it's best to avoid strenuous exercise. From there, you can gradually increase your level of activity until you feel like you're up to your normal level. I would expect this to be the case within a week. If your implant procedure also included a bone graft, you may experience some exfoliation of some of the bone graft particles. Essentially, these bone graft particles can feel like little grits of sand that you find in your mouth. This can last for up to 2 to 3 weeks and is totally normal. Depending on your surgical needs, you may receive dissolvable stitches or non-dissolvable stitches. The dissolvable stitches usually fall apart within 3 to 5 days and are lost naturally. The non-dissolvable stitches will be removed by your doctor at your postoperative visit. As a reminder, you will receive a written instruction sheet at the time of your surgery. If you need to get a hold of your surgeon, our personal contact information is there and available for you, and we're here to help you.